The Knotless AC TightRope repair system is designed for the reduction and stabilization of acute and chronic acromioclavicular joint separations. The implants feature a titanium clavicle button with suture locking technology and a stabilizing cup insert. For arthroscopic procedures, a dog bone button is attached to the suture loops after they are passed antegrade through the 3 mm bone tunnels. For open procedures, a large pack button is preloaded onto an inserter, which allows surgeons to perform an open or mini-open push-through technique without having to use a scope or access beneath the coracoid. The Knotless AC TightRope implants feature a No. 6 TightRope suture, adjustable loop technology, and a proprietary 5-point suture locking design to resist cyclic displacement of the construct and avoid loss of reduction of the repair. For arthroscopic procedures, first reduce and maintain the AC joint in the correct position, and then insert the aiming hook through a low anterior portal, placing the drill sleeve on top of the clavicle. Drill 3 mm tunnels through the clavicle and coracoid. Remove the guide, leaving the drill in place. Remove the stylet from the drill, pass a suture lasso wire through the cannulation, leaving the loop superiorly, and retrieve the wire through an interior portal. Remove the drill, leaving the wire in place. Shuttle the implant antegrade through the clavicle and coracoid and out of the cannula anteriorly. Attach a dog bone button to the loops and introduce the button under the base of the coracoid. Sequentially pull on the cinching suture limbs 1 to 2 centimeters at a time to reduce the construct. Once correct reduction is confirmed, cut the remaining suture limbs at least 3 mm from the suture bridge to complete the repair. For an open or mini-open approach, drill a 3.7 mm tunnel through the clavicle and coracoid. Fluoroscopy may be used to confirm proper tunnel placement. Insert the Knotless AC TightRope implant through the tunnels using light taps on the inserter handle. Once again, fluoroscopy may be used to confirm the implant is properly deployed through both tunnels. Remove the red pull tab from the handle to release the implant. Turn the stylet counterclockwise to release the coracoid button from the tip of the inserter. With the inserter still in place, pull on the clavicle button to seat the coracoid button under the coracoid. Once correct deployment is confirmed, remove the driver from the tunnels. Sequentially pull on the cinching limbs 1 to 2 centimeters at a time to reduce the construct. Once correct reduction is confirmed, cut the remaining suture limbs at least 3 mm from the suture bridge to complete the repair.